through the course of surgery, there are quite a few different IVs and tubes that are kind of put into and taken out of your body in the process. So I thought I'd give you an overview of what I remember from mine. The morning of surgery, there was a little bit of a prep step, and so they put an IV into the back of my left hand. And that was the only thing they really inserted before I went to the OR. And when I did go to the operating room, that's the one that they used to kind of give me my initial drugs to knock me out. And after that happened, they put in the rest of the IVs and tubes. So ones that I know that were put in is like a breathing tube and a catheter. They put another IV in the back of my right hand and something in my wrist to monitor my blood pressure during surgery. And then they also put in a central line, which kind of goes through your neck, and then it goes down and it basically delivers medication straight to your heart. And after surgery, they put in a drainage tube along the bottom of my abdomen. And then the tube kind of comes out the side of your stomach and it's attached to a bulb. And the part that's in your abdomen has perforations, so it is able to kind of draw any excess fluids that develop out of your body to help prevent developing an infection. And let's see, after your surgery is over, they're monitoring to see when you start to protect your airway again, and that's when they'll take your breathing tube back out. So I don't have any memory at all of having my breathing tube inserted or removed. When I woke up in the ICU, I woke up and I was aware of my surroundings around 4 p.m. was when I kind of have long-term memories. And at that point, I had my central line and my drainage tube and the rest of the IVs and stuff. Normally you stay about 24 hours in the ICU so they can closely monitor you after surgery. I was there for a little bit less than that because they were running out of beds and I was the most stable patient. So I was transferred to the regular transplant ward at about 2 in the morning. And the result of that is that I actually missed, when you're discharged from the ICU, they'll take your central line out. So I just needed to wait for someone from the ICU staff to come and remove that the next afternoon. And I was a little bit nervous when the central line was removed, but the most uncomfortable part of that was they have 2 stitches in it to help stabilize it, and then like a sticker that goes over your skin. And the second stitch for me was a little bit tight, so it was a little slightly uncomfortable clipping that one, and then the sticker accidentally caught on a little bit of my hair, so like pulling my hair off was the worst part of that experience. Pulling out the line itself wasn't painful. That afternoon they also had removed my catheter, which again was a quick and painless experience. After a couple of days they removed pretty much all of my IVs except for just one in the back of my left hand. They left that one in until I was discharged, just in case they might need one. And your drainage tube normally will just stay in for a couple of days. For me, they had cut a little close to the artery that goes along my liver, so they just left my drainage tube in for a bit longer to make sure everything was good before it was removed. And that step also is not painful, but it was the weirdest one. The little perforations from the end of the tube when you pull it out kind of creates a bit of a vibration effect, so it definitely felt odd. And the person who was doing it was saying, relax, breathe. And so in the middle of pulling the tube out, I did breathe in, and I, in hindsight, think that might have been a bit of a mistake. I'm wondering if maybe that allowed a little extra air to get into my abdomen that might not have gotten in there. And having air in your abdomen isn't necessarily a bad thing, But until your body absorbs the air, it can create kind of like muscle cramp or a spasm when you engage those muscles. So for me, for a couple of days after the drainage tube was removed, I had like little muscle spasms while I was engaging those muscles using the restroom. So it wasn't the worst thing in the world, but it also wasn't the most pleasant. And so my recommendation might be to either don't breathe at all or maybe breathe out while the tube's being removed, and perhaps, it might have a better result for you. So uh, that's all my experience and advice when it comes to IVs and tubes.